What is ozone ear insufflation?
So ozone ear insufflation is when you're going to actually take the headphone device that we actually have, and you're
You have it right there.
Oh, didn't say I was looking through my hair.
And we don't have it.
Oh,
It's just a product.
did I say we?
Yeah.
We haven't. Oh. All right.
Sorry, I shouldn't have interrupted you.
You're okay.
It's just in case you wanted to.
Oh no, you're good. I can actually just pick it up. So ozone ear insufflation is when you actually take a device such as this that is connected directly to the ozone generator, and you're actually getting ozone that goes directly into the ear canal. It can be utilized for multiple things, ranging from ear infections, sinus allergy issues, because ozone obviously is such a small molecule and it does bind very, very quickly. A couple things that we do recommend when utilizing ear insufflation is running it through a water bubbler to create moisture. The humidity from that actually helps it to bind within the ear canal, has more advantageous effects specifically within the ear canal. But some anecdotal responses that I've heard from a lot of patients and home users is just better mental clarity, helping with brain fog. I have seen cases of from pink eye to, again, even just ear infections, sinus and allergy conditions to help be resolved and remediate and get better quicker utilizing ozone therapy.
Can you talk to me about, so I can't remember if you've heard me talk on this, but I used to be like, some treatments are local and some are systemic and there is no in between. However, as I've learned more, it kind of appears that the ozone application really exists on a spectrum of very systemic, such as IV ozone, and not very systemic at all, which I might categorize ozone water in. So there's a spectrum in which therapies are, do we want to go into that? So, well, does it benefit the whole body? And so if I kind of explain that really quick, that things are, IV ozone, big systemic response. You're not going to get a whole lot of local response to that.
Right.
On the other side, you might have a joint injection, very much localized. It probably has a little bit of systemic effect, and ozone ear insufflation seems to be kind of somewhere in the middle, where we're not getting a full-blown systemic response, but there is still some. But its really primary focus is it's gonna have a heavy focus on the sinuses, the ears, the eyes, because all those are actually connected to each other. There's little tubules that fit in there. So
yeah,
it's really indicated for head issues, head, nose, and throat.
Okay. Ears, eyes, nose, and throat. All right, so one of the things I want to discuss is, the effects, a systemic effect of ozone therapy. There's kind of a wide range, and one of the things that we talk about is there are some therapies that have a very systemic effect, a very massive systemic effect, such as IV ozone, which we know is going to really not pinpoint one area, but have an effect throughout the whole body. I think one of the essential things when it comes to treatments or therapies or modalities is trying to get to the main source of whatever the condition is or the symptom is that you have. We talk about this broad spectrum systemic, it is, there's this line, and if you think of this bar and you have, the IV ozone having a massive systemic effect, and we could even categorize within that your rectal ozone as well. And on this other end, you're probably going to have something like ozonated water, which is probably going to be more localized. Now, when we're talking about ear insufflation, we know that we have a direct effect within the ears because that's where that ozone is going, but we've really seen the benefit of ear insufflation affecting pretty much anything within the head. So the ears, the sinuses, the eyes, because they are all interconnected. And so there is somewhat of a systemic effect within this region, and that's when I would recommend utilizing ear insufflation for an individual that may be dealing with something more within the head region, not necessarily systemically.
Okay. And then, does it get into the brain?
I would say in a sense, yes.
There's actually some research on this.
Yeah.
Not to the brain specifically, but you know, you have your eardrum there, which kind of blocks everything off. But what they found is in, I can't remember the type of hearing loss. I think it was age-related hearing loss. It actually improved the hearing, and it was Dr. Bucky that did it. Kind of a funny name. But anyway, so we don't know 100% what effects it has on the brain. It appears through some preliminary data and through these anecdotal responses that it might be beneficial for the brain, but you know, I wouldn't bank on it. Like, you know, if I had some sort of neurological issue or brain issue, I might give it a try because I know it's not gonna do any damage. It's probably gonna cause improvement, but I would put my money more on the IV ozone, the rectal ozone, as having a better effect on the brain, but nonetheless, I would say that it's probably worth giving a try and see what kind of response you get.
Yeah. So I've had a lot of patients and people ask specifically about, does, you know, ear insufflation have an effect, and does it, you know, kind of cross that blood-brain barrier? Does it get into the brain? You know, there is some research that shows that it may, but this is not a treatment that's meant specifically to treat, I guess, brain-related conditions. What we'd probably be looking at more in that instance is something like an IV ozone or rectal ozone that's going to have more systemic effect. If you are somebody that may be dealing with a neurological type condition, I would probably veer more towards those. But if you're going to be doing something like ear insufflation, I mean, it's not going to have any adverse reactions. It may have some benefit as well, and there could be some possibility that it is crossing because of the connection within, you know, everything from the sinuses, the ears, and the eyes. I mean, that interconnection, even the cribriform plate within the sinuses does have a cross barrier into that blood-brain barrier, so there are ways that it can actually cross over. So it won't hurt to try it, and if you had some advantages and benefit from that, I would definitely give that a try.
Great. Oh, can you talk to me about kind of the things to watch out for, like the discharge, itchiness, and discomfort, and how that if you experience those, that means you're doing too much. And the way you reduce it is not by the gamma, it's by time. So you don't reduce it by reducing the gamma. It's a time therapy. All time therapy is the only way that you can actually cut the dose on these. And mathematically, I can show you, but the only way to actually cut the dose is by reducing time.
Okay.
Because if you run that for a minute on any of those settings, the total dose of ozone is identical.
Oh.
It's kind of interesting.
Because
you're compensating with volume.
Right. So yeah, because I mean, if you're at 11 at 71 for 1 minute, but if you're a 1 at 7 for 10 minutes, is that no, it'd be longer. It'd be longer. Yeah.
1 minute is, I can do it on the board and show you, but I wouldn't say that part anyway. I would just say you reduce it by time. So
Not
if you do have that means that you've done too much ozone, because you should not be getting that response. And some people will add to it because they might have an infection or something going on there. But what you want to do is discontinue the therapy until that goes away. You can take some vitamin C and that kind of stuff. But then if you come back to it and decide that you want to continue doing it, you would want to cut your time down significantly. So if you were doing 4 minutes, then do it for 1 minute.
Okay. All right. So some of the things that can actually happen when doing ear insufflation is you can have some discomfort. It's not common, but every once in a while people will say that they're dealing with discomfort or even some discharge. That's not something to be afraid of. Just know that it can happen. You could have some underlying infection or something else happening. In the instance that you're dealing with discomfort, discharge, itchiness, or any sort of irritation, the number one recommendation is to cut down on your time. So if you're, say, doing 4 minutes of the ear insufflation, cut it down after it's resolved. So key there, make sure that that issue has been resolved. It may take a couple days, it may only take 24 hours, but when you come back, cut that time down. So say you're doing 4 minutes, cut it down to maybe 1. I've had some patients and users that have cut down to 30 seconds. The other thing that I would say is when you're first starting to utilize it, you can look at the protocols on the frequency and the gamma and concentration, but I would definitely say start low on your time and build yourself up. Don't try to go all the way right away. And some other things that you can actually add in there if you're dealing with discharge irritation. I do recommend you can actually use ozone oil if there's skin irritation. That'll actually help to reduce that. Increasing your vitamin C, that's going to help as an antioxidant to help with the body and its restoration as well.
I think that's good, right?
Yeah.
And the ears.